Thanks everyone for being here. I'm Representative S.J. Howell from House District 95 in Missoula, and I'm really excited to have you all here to celebrate the passage of House Bill 648, which is really a landmark bill on childcare in the state, and also get to talk a little bit about what the policy means and how it's going to impact working Montana families across the state. Before we dig in too much, though, I want to say there was an incredible amount of work and effort that went into moving House Bill 648 through the process and crafting a policy that really we feel works for everyone, for all the stakeholders and all the policymakers involved. And I'm really proud to have been part of that effort. But House Bill 648 really enjoyed a lot of bipartisan support. In fact, President of the Senate, Senator Ellsworth, loved it so much he held on to it for over a month, couldn't really bear to part with it. Didn't want to let it go. But nonetheless, here we are on the other side of that, and just 3 days away from implementation of this bill, which we feel is a pretty big deal. I want to reflect just for a minute about how we got here. During the last interim and coming into the session, our caucus and the advocates and providers and parents that we worked with, we really knew that childcare in Montana was at a tipping point. We were really facing a crisis. And, we knew that for many, many years, we had seen a lack of state action, that despite childcare being truly a fundamental building block in what helps our communities run, the state had not taken seriously the need for support and investment. I personally feel like childcare is one of the most important jobs out there. I mean, these are folks who are taking care of our kids. That certainly is really meaningful to me. And the folks who have taken care of my kid over the years, I feel like they did a tough job. Let's just say that. Just kidding. He's a gem. But I think the state has not taken seriously the ripple effect of lack of affordable quality childcare on our communities. During the pandemic, we saw some federal investment and federal policy change, temporary federal policy change that came along with that. And we saw immediately how helpful that was in people's lives. But when January 1st, 2023 came along, that federal investment ended, the temporary policy changes ended, and we saw families and providers facing some really, truly untenable choices. Choices about whether or not they could stay in the workforce, choices about whether or not they could stay in their communities. And that's the position that we were in when we came into work in the legislature and got to work on this bill. I'm really proud of the work that we were able to do, and I think this bill is going to have really powerful immediate impacts. And I'd like to introduce our first speaker, who's going to talk a little bit more about what that policy is and what those impacts are. The sponsor of House Bill 648, Representative Alice Buckley.
Thank you all so much for being here. It feels really good. And I think one of the reasons it feels so good is because this bill passed its final Senate vote in the dog days of the session, and then was signed by the governor in mid-June. So there hasn't been a chance to be all together and to celebrate this. And that feels really important and really moving to me. And it makes me think about how symbolic it is to be in community around this, because nothing about this bill happened in a silo. Nothing about this bill was an individual effort. It took, as Representative Howell said, many people, providers, parents sharing their lived experiences and their stories, advocates who worked tirelessly at every single step of the way, which from the perspective of a super minority meant a lot of hard work. and our colleagues across the aisle. So it was really collective communal work, which makes me think about the care of raising our kids and how communal and collective that work is, how it was never meant to take place just within a home, how it is a societal responsibility. And so it feels so nice, I think, to be talking about this in community here. But this bill is a really big deal, and it's a huge win, and I want to talk a little bit about why. The first is for parents. It's taking a program that has been in existence for 30 years, but for a lot of reasons has been unworkable or unmanageable for parents who've been paying $400, $500, $600 in copays, parents who are just over the 150% of the federal poverty level, who weren't able to make this work and were stepping out of the workforce and not able to get the care they needed. So to add in a cap of 9% of copays to raise that eligibility level is a really big deal, and it means that we're using our taxpayer dollars that were already going into this program in a much more effective way. It also means a single parent now making $30,000 is eligible for this program. That is amazing. Or a family of four making $53,000 is now eligible. So it's really important. And then for providers who are now finally getting the same reimbursement equation for Best Beginnings kids as they are with families who are paying out of pocket is important, not just for those Best Beginnings kids, but just for the financial stability of the market in general. So I think about the ripple effect that that's going to have. And then, of course, for all those parents who are now going to be re-entering the workforce, think about this from a workforce and economic development perspective. It's a really big deal for Montana. And again, just on a symbolic level, I think, as Representative Howell said, we haven't had a substantial conversation about childcare in the context of the legislative session before. Last session, it was really hard to get traction around this. It was still relegated to a conversation about the home and about families. And that's because childcare has been the work of mothers and of women, of brown and black women who have been doing this work undercompensated or uncompensated. And so to bring this conversation into the halls of the Capitol, into committee rooms, onto the House floor, onto the Senate floor, just feels moving to me. It feels important. It means that we're finally talking about care and childcare as an essential part of our economy, about the importance of childcare when it comes to a child's development, when it comes to parental choice and earning potential, when it comes to our small businesses. So it just feels moving to me, and it feels like a foundation that we can really move from. So I just stand here with all of my gratitude. I couldn't have done this without Representative Howell. We worked hand in hand, and this came out of the brain and the heart of Heather O'Loughlin with the Montana Budget and Policy Center and Ellis Smith and all of those who moved this bill along, let alone, as I said before, the stories and the lived experiences of parents and providers. So it feels good. Thank you.
So like Alice said, some of the most important voices in this effort are the providers and the parents, and we're really lucky to have a couple of those voices here with us today. I want to introduce Jen Gursky, who is the executive director of the YWCA here in Helena, and through that role runs the Caterpillars Clubhouse.
Thank you, Representative Howell and Buckley, for having me here today. My name is Jen Gursky, and I'm the Executive Director of YWCA Helena. And we do a number of social service, human service type aspects, and one of those is the Caterpillars Clubhouse. Launched about 18 months ago, we decided that we needed a licensed childcare facility to be able to help the women and the kiddos that we serve in one of Helena's women's shelter that works with violence in the home, that works with substance use disorder recovery, and really helps women and families stabilize on their feet into independence and out of homelessness in our community. When we developed the Caterpillars Clubhouse, it was to serve a child that lived at 150% of federal poverty, that had a traumatic experience in their family, and had experience with out-of-home placement in the foster care system. Best Beginnings is our bread and butter to keep that open. What became quickly relevant and our experience was that we couldn't do it with Best Beginnings. We couldn't do it even if we had full enrollment, if we had the parent or the child to adult ratios. We couldn't do it without significant underwriting of finding grants. How people in private business do it is that they just start not accepting Best Beginnings kiddos, that they do private pay only. And it leaves our most vulnerable children at the sidelines waiting for somebody to care enough for them and their families so that their family cannot be languishing on the vine of economic independence and prosperity. That's what the YWCA does. And the news that House Bill 648 had been passed and in itself languished on said vine until it got out of our Senate president's hands and then signed by the governor. When that finally happened, I brought some Caterpillar staff with me today, and we actually did a hoop and a holler in our office, because here's what it means for us. That change, there's a change in this bill that changes from how many days in attendance a child can be reimbursed for from the state to how many months or the month of enrollment. That's what many of us are used to, folks with privilege, folks that are able to come and say, I can pay for childcare privately. The problem with a provider that accepts Best Beginnings is prior to this bill passing, if a kiddo missed 10 days, let's say they got COVID, and then they continued to, and persistently were sick, I only got paid for 2 weeks of care. I don't get to lay off staff. My budget does not decrease because kiddos don't come to care or don't come to childcare. Might I remind us that Montana still doesn't have universal pre-K. So for ages 0 to 6 years old, providers that are utilizing Best Beginnings Scholarship is often the best tool that we have to get folks into intervention therapies, into case management, into SNAP benefits, into public housing, into places that we have decided to take care of families in our community. And it's often done through the schools, and in a state without universal pre-K, it's done through the child care providers. I want to share a small, it's not a small story. I'm going to take a small amount of time to share actually a big story. One of the moms that we have utilizing Caterpillar's Clubhouse, which is a state licensed facility, was fleeing domestic violence. Was a resident and a woman at the Friendship Center, which is Helena's domestic violence shelter. And she had, at the time, an 18-month-old. She could not access Best Beginnings Scholarship at the time because the person that she was fleeing still had custodial rights. And Best Beginnings was taking into consideration his income. When they finally were able to leave the shelter and get housing on their own, a 1-bedroom apartment for them was $1,200. It was still 5 miles from the Caterpillar's Clubhouse. This woman was making $18 an hour by herself. That's roughly $2,500 after tax. But now let's take away the $1,200 rent. Now let's take away the copay that the state that she said she could pay, which was nearly $400. Now let's take away the 10-year-old car that she still has a car payment and insurance, and because of her $18 an hour wage does not qualify for SNAP. She was left with $50 in her budget of just written down necessities after Best Beginnings scholarships were applied. I know that we can do better, and this bill does better for the folks in our communities. It does better for the folks that are struggling with challenges that some of us will never know, but it also does better for the folks, just exactly as the representative said, wanting to be in the workforce. Her decision prior to this implementation that will happen technically on Saturday, but we're not open on Saturday, so Monday, her response to her reality was to decrease hours at work so that her copay could change, because that was the only thing in her budget that had any wiggle room. This bill helps us do better by Montana families, and it helps my business and my childcare stay open. Thank you.
Thank you so much, Jen, for coming and for sharing and for the work that you do for the work that all of you do. I think this point about co-pays and about the experience that individuals have trying to navigate this program is really, really salient. And the co-pays portion of this bill is something that Representative Buckley and I fought really hard for, in part because this is something that is immediately going to impact thousands of Montana families. Every family receiving the Best Beginnings Scholarship will now have a capped copay. So I'm really excited to have a speaker here who can talk about her own experience with Best Beginnings, the best beginnings of the past, the best beginnings that really didn't work well for folks, wherein a copay could actually be an economic barrier to receiving that scholarship and having reliable, consistent care. I'm pleased to introduce Valerie Knowlton.
Hi, thank you for having me today. My name is Valerie Knowlton, but the most important people call me Mom. I know firsthand how hard the childcare crisis is hitting Montana families. I applied for Best Beginnings in 2021 when my husband and I were both working full-time and needed care for our two youngest children. We were already having a difficult time finding a facility that could provide care for both of them, and we had to end up settling for part-time care. Of course, we had to readjust our schedules, and sometimes that meant not working the hours that we should have been working. We were able to figure things out until our 5-year-old started kindergarten, and the facility that we were using were able to get our youngest child into full-time care. However, the hours still didn't cover our work hours. It was an improvement though. Eventually, our Best Beginnings co-payment grew so high that it was more expensive just, to pay for the co-pay than it was paying directly for care. As a low-income family already struggling to make ends meet with older kids in public schools, we were facing an impossible set of decisions. Because of this, we ended up withdrawing from the program. Like lots of other families, we just want to be able to struggle a little bit less. But at the end of the day, our family has been able to make it work short term. But it certainly isn't easy, and there are many families out there that can't. House Bill 648 is a big step. We have to do better for our kids and our communities. I know so many families like mine whose childcare costs are the same or more than what they're paying for their mortgage or rent. We need more legislators willing to fight for our children. And I'm so grateful for our representatives Howell and Buckley for fighting for us. This law will make such a difference for parents and families like mine who just need a little bit of extra help. Thank you.
Thank you so much, Valerie. I'm happy to take any questions if folks have them for any of our speakers.
Question about workforce, because I know that's still a huge issue, in a lot of industries right now in Montana. But if you could maybe speak to a little bit more, or someone else could speak to a little bit more, how this bill might help address that specific issue in trying to retain and recruit childcare workers.
Great, I'll take a first stab at it, and Alice or Jen, if you want to jump in. One of the really important pieces of this bill is the reimbursement structure, and Jen talked about this. So previously, Best Beginnings would reimburse really based on a formula that had to do with how many days per month a child was at care. And we all know, especially with little kids miss care, they get sick, you pull them out for whatever. And when that happened, providers would have an empty spot that they couldn't fill and they weren't being paid for. This is different than a private pay childcare. All of us who've signed our kids up for care know you pay for a month at a time, and if you don't show up, you're still paying that bill. So that reimbursement structure alone gives financial stability to providers who are serving Best Beginnings kids, which I think is going to make a difference in terms of those providers' ability to balance their budget, pay folks a living wage, and recruit and retain workers. I would also say that more families being eligible for care likely means more families having consistent, reliable childcare payments that they can make, which is, again, I think helpful for increasing the need that childcare workers can staff up. And finally, last thing that I'll say is, childcare workers are often the folks that we're talking about. They are low-income women. They are parts of low-income families. A lot of childcare workers themselves may find themselves eligible for Best Beginnings and have access to consistent care and be able to work more reliable full-time hours. So this isn't a full or total solution, but we think it's a really important piece of the puzzle. Any other questions? All right, well, thank you all again for coming here, and we are so excited to have this bill be signed into law and go into effect in just a few short days. Thanks everyone for your work and for your participation.